Okay. Wave vigorously.
I will.
In 2009, Horlicks began. Oh, that's not good, is it? Okay. In 2009, Horlicks began test marketing of an affordable brand of its ubiquitous malt-based drink, which was recalled Asha, to be sold in 2.5 rupee sachets in villages across Andhra Pradesh in South India. And in marketing this product, Horlicks owner GlaxoSmithKline claimed it would be a scientifically based alternative to local cereal mixes of uncertain quality, such as ragi or finger millet. In 2011, Coca-Cola began rolling out a new sachet-based orange-flavoured drink, which is fortified with 12 vitamins, and is promoted as helping to combat blindness, anemia, and other common diseases across 30 districts in Orissa, in collaboration with a local NGO and self-help group. Also in 2011, PepsiCo, India, launched a new salty biscuit called Liha Iron Shusti, which it rolled out also across Andhra Pradesh in 2 rupee packets, alongside a major education campaign on iron deficiency for women and teenagers. So what are the implications for debates around global health inequalities and rights to treatment when we're talking about nutraceuticals rather than pharmaceuticals? What kinds of nutraceutical cells are made up when food becomes pharmaceuticalized and becomes marketed as a solution to micronutrient deficiency rather than hunger? And in this presentation, I really want to sketch out some of the issues that are raised when we shift debates around relationships between industry, state and markets and patient consumers from global pharmaceuticals to global nutraceuticals. What are the implications, particularly when those nutraceuticals are being marketed to the rural poor rather than to the urban middle class? And I've put all of that up front because I might not get to the end. So what is a nutraceutical? Well, this idea was coined by an American physician in 1989 as a food or part of a food that provides medical or health benefits, including the prevention and or treatment of a disease. Well, there are lots of different kinds of categories of what people claim to be nutraceuticals, but the category that's really gaining the most attention from development organisations and from industry at the moment is the idea of fortified food. So that is foods that in the laboratory have had vitamins and minerals added to them at the molecular level. And this development of a market of fortified foods has coincided with 2 shifts in global health discourse. The first is a shift from talking about hunger to talking about hidden hunger. That is a talk from talking about the lack of food to the quality of food, and particularly talking about the quality of food in terms of its micronutrient content. And this is really seen now as a high priority area for bilateral and multilateral organisations. For example, the Copenhagen Consensus in 2004 claimed that providing micronutrient fortified foods was actually the best had the best economic benefit to cost ratio after control of HIV and AIDS. At the same time, we've had the growing global concern about chronic diseases and non-communicable diseases. I think this is one of the things that makes nutraceutical markets so interesting, is that they've been established in these urban middle class markets around growing concerns about non-communicable diseases, but increasingly they're being kind of promoted as the solution to hunger and famine and which has now been kind of re-termed micronutrient deficiency. And I think what's interesting is that this notion of micronutrient deficiency isn't in itself particularly new, and governments have been providing supplements, for example, for decades. But and what really has emerged over the last 10 years is this idea that food fortification is the solution. To the extent that you have the World Bank saying probably no other technology available today offers as large an opportunity to improve lives and accelerate development at such low cost and in such short time. And these are the kinds of figures that are being thrown around in terms of the potential growth for the nutraceutical industry, both globally and in India. So in India, for example, it's seeing a growth rate of 20% over the last 3 years. These are all quotes, so the references aren't up, but they're all quotes from investment analysts and from the nutraceutical market and annual reports. So, and it's projected to, by 2015, projected to have a value of about $5 billion US dollars. Okay. So this is an area that's really of interest both to the pharmaceutical industry, who, as we've seen, are concerned about the high investment required in R&D for pharmaceuticals. The really interesting thing about nutraceuticals is that actually they have a very high margin in terms of the relationship between the investment and how much you can sell them for the profit. On the other hand, you have the food industry, and particularly in developing countries, the fast-moving consumer goods industry, who are particularly interested in getting kind of value added to products which are competing with kind of a lot of different local products as well. And the ways in which both the food industry and the pharmaceutical industry are trying to kind of add the value of science to food is by setting up these scientific and clinical institutes. So you have the Horlicks Nutrition Academy set up by GlaxoSmithKline and the Beverage Institute for Health and Wellness set up by Coca-Cola. And these institutes are doing research now both on kind of homemade local foods, which establish essentially that they're deficient in terms of their micronutrient qualities, and at the same time they're doing research then on the products that they're developing to show exactly how they're going to kind of transform the disease profile in these areas. Okay, so up until places like India, which have what health economists are talking about as a double disease burden, are seen as a double nutraceutical opportunity. So up until now, the nutraceutical industry is really focused on the growing urban working class population by marketing more expensive, higher margin products. And this is where Horlicks has been really successful with, for example, 50% of the fortified foods market in India. And actually Horlicks is the second highest selling beverage in India after bottled mineral water. So this isn't a kind of marginal market. But I think that the food industry in India is also increasingly interested in tapping new markets amongst the rural poor. And India alone boasts the world's most undernourished population of over 200 million, and there are a million other figures I could bandy around, and these figures are seen by the nutraceuticals industry as a real opportunity for the expansion of the nutraceuticals market to the bottom of the pyramid. And this is a business model which is kind of based on the mantra of low margin, high volume sales, and it's branded this way of doing well by doing good, i.e. we can make profit and we can also contribute to development. Okay, nonetheless, I just move on a little bit. Okay, I did research, some preliminary research in a small mixed caste village in rural Orissa, and actually this is a village which is sort of on the edge of a Naxalite insurgency on the one hand and a large mine on the other. And this is the Adivasi colony in this village. And this area is sort of really right on the border of Andhra Pradesh and very close to the areas where a lot of these new bottom of the pyramid market products in nutraceuticals are being rolled out. But one of the things that was really interesting about this village was that actually I didn't find very many fortified foods there. In fact, I found two. One was Horlicks, not the Asha brand, not the bottom of the pyramid brand, but actually the established Horlicks brand, which only the higher caste dairy farmers were being able to purchase in small amounts. And so certainly wasn't reaching the less wealthy communities. And secondly, biscuits. And so first of all, before I go on to biscuits, let me just say what some of the problems that that corporations have actually found getting these products out there. First of all, actually they found that it's expensive to package products so that the vitamins vitamin content can actually be sustained and doesn't depreciate. And secondly, they found it very difficult to actually get them out there in terms of distributing to rural markets with poor infrastructure. And so the solution to this model of getting these products out there is seen to be public-private partnership. And this is where like the UN has helped set up GAIN, I'll go back one, the Global Alliance for Improved Nutrition, which is essentially a set of relationships between big corporations like Coca-Cola and Pepsi and GlaxoSmithKline, alongside large development agencies, and is meant to be helping to create what they call market access. So the problem is seen to be, oh, I don't think that's for me. I think the problem is seen to be that actually how do we actually create markets? The market isn't actually going to do it itself because it isn't really affordable to get it out there. So we've got to help that work. And one of the ways to help that happen is, for example, for UNICEF to provide an entire education campaign to actually create the concept of nutrition in these areas. So the idea is, well, actually the reason that these products aren't selling in these areas already is because people don't have a notion of vitamins and minerals in their diet. That isn't how they're thinking about foods and that they're consuming. And so you actually have, on the back of large global health education campaigns, which are being funded by UNICEF and by governments, these corporations then coming in. So those campaigns are essentially designed to create a market. They're also often actually buying the products themselves. So when we think about nutraceutical Selves, we also might want to think about who the consumer is. Okay, lastly, because I've run out of time, I think one of the interesting things was the only other nutraceutical I could find was these biscuits. And biscuits are bought by children in this village as a kind of hospitality issue. So they're not bought. There are particular foods that are categorised as kind of health-giving foods, but these are actually just gifts and things that circulate as hospitality, and often they're being purchased by children rather than by adults. And so although all of this labelling is on here about all of these 10 essential vitamins and the protein content and so on, actually this product isn't kind of being incorporated into a whole set of kind of associations between particular foods and health. It's sort of just seen as a supplement to those. So the question really is whether, are we going to assume that that nutraceuticalisation involves a kind of biomedicalisation of food, and are people in rural areas actually going to take on new kinds of understandings about food and about the body in the context of these new products? Okay, I think I'll stop there because I don't have time. Okay, thank you.